Survey in the news this week concerning access to health care, and it was quite worrisome, the finding, because 43% of Quebecers admitted to Leger that they had not accessed health care over the past year because they had problems. So they forewent health care over the past year because they were worried that they wouldn't be able to get an appointment, wouldn't be able to find a doctor, wouldn't be able to get in at a clinic. Here to tell us a little bit more about this survey is the big Union Centrale that was behind it, the CSN. We welcome to CJAD 800 President Caroline Senneville. Caroline, bonjour.
Hello.
Hello. How many healthcare workers do you have under the CSN umbrella?
Oh, I would say 175,000.
So this is one of the big centrale here in Quebec.
We're in the health sector. We're the biggest.
Why did you decide to go to Leger and craft these questions about access to health care? Internally, there must be worries about it.
Well, actually, people have been telling us the private sector is taking up more and more space and more place. So we wanted to see how the public felt about it, because we're speaking a lot about it, but what do the people think? And what they think, well, you said it, they think that the access is really bad. 56% of the people that we surveyed said that the private sector has taken up more place in the last 5 years, and 6 out of 10 think it's a bad thing. So that's some of the things that we found out.
Because you represent healthcare workers who see the consequences of this, that 43% number really worries me, because 43% of people who did not access healthcare, that means, sometimes maybe it was just a bad flu, and it went away. Other times it could be something really serious. It develops into a cancer that is spread. It develops into an infection that needs treatment. It seems to me to be kind of like the canary in the coal mine.
It is. And it's not only an issue for the health workers, it's an issue for every citizen in Quebec. Because the health care is our health care. We've built it. It's not government owned. It's people's owned. We feel that people are the public health system is threatened. It's like every year they take a little bite out of it. And we see clinic coming up, that are for profit organizations. We see doctors leaving actually the public sector, as we've seen for nurses that were working for agencies. So there's always a shortage of workers. Yes, and the lines keep getting longer and longer. So, and what we want to put forward also is that people might think, if I take an appointment in the private sector, that makes an appointment available in the public sector. So I'm helping the public sector by going to the private sector. The thing is, you're not, because you're not giving away an appointment. You're taking away a doctor, the nurses that work with the doctor, the office staff that work with the doctor. And when those people work from 9 to 5 or maybe 9 to 8 only on weekdays in private clinics, they are not in the public system helping everyone.
Have you not been reassured by anything coming out of the CAQ government? We've heard from the health minister that the spread of the private sector has become a concern. They're looking at stopping the flow of doctors into the private sector. They're looking at obliging new grads to remain in the public sector for a certain number of years after graduation. Does none of that give you hope?
Yes, it does. And I think the government has taken a few measures. We'd like it to take more measures. And I think it's a sign that if the things are really bad right now, if the government is taking these steps, take, for example, the number of doctors that do not practice in the public system. There are more than 600 of them in Quebec, in the province of Quebec. There are only 14 of them in the province of Ontario. So it's becoming bigger and bigger. It's starting to become huge. So the government has to take action. We have a big meeting in Trois-Rivières and Three Rivers on the 23rd. We're going to be a few thousand there, and we're going to put forward some more measures, some more solutions. We can't always be there complaining. We want to put forward solutions, and because we care for our public system because the public system cares for everyone.
It does seem that Quebecers are kind of two minds about private health care. It's not that they don't trust it. They'd be willing to go private. You know, the numbers overwhelmingly, they'd be willing to go to, for example, a private surgical clinic or something like that if the province paid. So there seems to be a certain view that the private system is efficient and effective. It's just the cost. I'm wondering if that's just a symbol of desperation.
I think that's part of the answer. Is that it's a symbol of desperation when you're and people that do go to the private sector because they feel that their health is jeopardized. I mean, nobody's going to blame them. So that's one thing. The other thing is, if you ask people that make a lot of money, they will say, "Oh, I don't mind going to the private sector." If you ask people with less money, they say, "No." So that's also an issue because people that are sometimes that go for the private sector either wants to make a profit out of people being sick, or they think that they're wealthy enough, and maybe healthy enough too, but they're wealthy enough so that they can pay for themselves. But that's not the case of everybody. I might remind you that 10% of the population of Quebec do go to food banks just to eat. So do we want people to be in a position that where do I pay for medical bills or do I pay for my rent? I thought that the whole idea behind being Canadian is something that you didn't want to happen.
Yeah, no, that's certainly something that we always point fingers at the States about, people having to make decisions about whether to pay the rent or pay for their health care. And no one, I don't think, wants to go down that route. At the convention that's coming up, the big gathering in Trois-Rivières, do you think you'll be able to come up with solutions that are not draconian? And I just raised that question because even the CAQ government has acknowledged that what it's looking at, for example, obliging new grads to stay in the public system for a certain number of years, it touches on rights. It touches on your right, your mobility rights, for example. It touches on your right to kind of set your life up the way you want to. Can there be solutions that are not in that field, not so restrictive?
You know, you and I cannot own a pharmacy because we're not pharmacists. How come people can own private medical clinics if they're not doctors? For example, that's one thing we can do. We can make private companies that do deal with the public sector make their books open to the public so that we see where the money goes. So that's a few things that can be done. But as a government, you also need to send out a really strong political message that they will defend and put forward and improve our public health system that badly needs it.
How quickly do you think this can be done? Because judging from the poll results, 43% of Quebecers going without health care because of access problems, it's urgent.
It is urgent. And they also, in the survey, you will find that they think that the different reforms we went through were completely useless. So I don't think we need another reform. We need to hear what the people that are working there, what their solutions are. We have to have faith in their professional judgment. We try to run hospitals or social services like a line an auto line in a shop, and sometimes taking 10 minutes or 15 more with a patient doesn't fit in the form. It doesn't fit in the forms, but it's still very useful because you're dealing with humans and reassuring a distressed patient. patient may be really helpful for the future, so he or she won't come back into the system because she or he felt reassured. So we need to make our system more human, and that's something that came up also in the survey, that people think that the population in general, the patients in general, and the workers should have more of a say on how the system is run.
Well, all food for thought. Thank you very much, Caroline Senneville, for joining us on CJAD.
Well, thanks for your invitation.
Caroline Senneville, president of the CSN.